This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, thank you. Thanks for having us. My name is Holly Pager. I'm the residency program director for the adult PM&R program, and also on the call tonight we have Dr. Ashley Bolger, and she is the program director for the combined pediatric and PM&R residency program. So we also have a few slides to share here. So just a little bit of background about our program. The University of Cincinnati College of Medicine was established in 1819. So the fun fact there is it makes it the 8th oldest in the country. We have 56 accredited residency and fellowship programs and 690 residents and fellows. So UC Health, it's Cincinnati's only academic medical center. It's comprised of UCMC, which is the main hospital, Westchester Hospital, which is a little bit north, and then the Daniel Drake Center for Post-Acute Care, which is where we have our acute inpatient rehab facility, a skilled nursing facility, a long-term acute care facility, and some of our outpatient clinics. UCMC is the region's only level 1 trauma center, so we see a lot of that traumatic spinal cord injury, traumatic brain injury, and they all come are sort of filtered into us. And there are more than 1 million patient encounters annually. So some of the specifics about our physical medicine and rehab residency program. It was established in 1988. It is a categorical program, and we have 3 residents per year for the adult PM&R program and 1 per year for the triple board program, which is the combined pediatric and PM&R residency program. We have several clinical sites that include UCMC, which is the main hospital where we do our consults, and the Drake Center, which I mentioned, which is where our inpatient rehab hospital is. We also have outpatient clinics there. UCGNI is is our new building for outpatient multidisciplinary care. There's an outpatient clinic in Florence, Kentucky. UC Holmes is right on the main campus as well, and then the Children's Hospital and the VA hospital. Our residents take home call. It's a Friday to Friday. So they are carrying the pager from Friday morning until the following Friday morning, and then they switch. So they're carrying it for the whole week. They come into the hospital and round on the inpatient, at the inpatient rehab hospital on Saturday morning, but otherwise are just carrying the pager the rest of the week. So I mentioned the Gardner Neuroscience Institute. This was opened recently in April of 2019. It's a brand new building. I guess now it's a few years old, but it's basically our home for multidisciplinary neurologic care, education, and research. It's a 114,000 square foot building. There's 125 physicians across 15 specialties, including physical medicine and rehab. There are several clinical trials going on. That's just a picture of the building. So some of our highlights. So we do have protected didactic time on Thursday mornings. All of our residents are removed from their clinical duties during that time and have usually a 4 or 5 hour window on Thursday morning just for didactics. We also have continuity clinic for our PGY3s and 4s. They are in a clinic with a faculty facilitator where they manage all of their own patients. Our PGY2s are also given the opportunity to have a continuity clinic but it's a little bit different in that they pick a clinic of interest. So if they're interested in spinal cord injury or sports medicine or musculoskeletal medicine, they can pick a clinic to join and spend their time a half day per week in that clinic. So right now, for example, we have two residents that are interested in peds, so they're spending a half day a week at the Children's Hospital, and we have one resident interested in neuro rehab, and so he's doing a half day in a neuro rehab clinic. We do have sports coverage, both at the high school level, the college level, and there is opportunity for game coverage, sideline coverage. We have a Google Drive that has been accumulating resources for the past several years. So it is stocked with all kinds of different material that's been put in there by prior residents. We do prioritize wellness. We have a wellness curriculum that is composed of a quarterly wellness component to the didactic session. So, as part of the Thursday morning, we'll incorporate something related to wellness. And then twice per year, we do something, we try and incorporate an off-site event. And then once per year, we have a wellness retreat. That's the picture actually on the bottom right, or on the bottom of the screen here, where we spend the entire day off-site. Half of the day is dedicated to program improvement and discussing how we can improve our residency program. And then the other half of the day is professional development type topics. And then the other highlight of our program is it's fairly customizable because it is a small program. We have options to sort of create some flexibility in the clinical schedule. So speaking of that, because it's categorical, we have our PGY 1 year. So for our interns, they have 6 months of internal medicine, 1 month of neurology, 1 month in the neuro ICU, 1 month with rheumatology, 1 month of ortho, 1 month of urology, radiology, and then a block of PM&R consults. I said month for all of those, but it's actually similar to Mayo. We have 13 4-week blocks. So they're all in blocks. And then for, I'm not going to read through all of these, but as you kind of progress through your PM&R residency, you kind of start out with more inpatient rehab, and as you progress, you do less and less. Also similar to Mayo, we have a junior senior role on the inpatient rehab unit where we have a senior resident and then 2 juniors. As you progress, you do more outpatient time, and then we do have elective months, both for PGY3s and PGY4s. One of the highlights I'd say also of our program is our connection to the Children's Hospital. Cincinnati Children's has been ranked number 2 or 3, depending on the year, on the U.S. News and World Report. Our adult residents go spend 2 months of their or 2 blocks, I guess, of their residency over at Children's, 1 on the inpatient rehab unit, and then 1 in outpatient. And then our residents also go to the VA Medical Center to do several outpatient clinics, including spinal cord injury, brain injury, prosthetics and orthotics, and EMG. I mentioned the didactics earlier. This is, again, is a dedicated half day on Thursday morning. It's separated into blocks throughout the year that sort of mimic what you see, how it's weighted on the boards. So for example, there's a block for prosthetics and orthotics, but it's much smaller than the block for musculoskeletal medicine. And then also scattered throughout the year are these other types of didactics. So we have an intro to PM&R lecture series every year. It's more geared for our new PGY2s, but everyone kind of gets a little refresher right at the beginning. We have EMG and MSK conferences that happen monthly. We also have monthly journal clubs. We have also have gross anatomy series that happens every year in the fall. And then we have when our residents are on their peds rotation, they attend pediatric rehab lectures, and there's also an optional regional pediatric rehab symposium. And then I skipped over the ultrasound course. This is a symposium that's happens twice per year, and our residents are encouraged to go to it, and also they sometimes teach at this. So research opportunities, we do provide funds for traveling to conferences for accepted research. We also have an annual resident research day, usually at the end of the year, for all of our residents to present any ongoing research that they've been working on. And then we have a motor recovery lab led by Dr. Wole Awasika, who has been working on focusing on motor recovery after a stroke. We also value teaching and have several opportunities for our residents to become teachers. So there is the medical students have an ultrasound curriculum, and the PM&R residents are invited to join for the wrist ultrasound and to teach wrist ultrasound to medical students. The medical students also have a MSK clinical skills lab where our residents help teach the physical exam for the knee, spine, and shoulder. And then, as I mentioned, there's the ultrasound symposium, which is 2 half days per year. And then our residents are also very involved with teaching of 3rd and 4th year medical students on inpatient rehab and consults. We are lucky at the University of Cincinnati that the 3rd year medical students can rotate within PM&R, so we often have both 3rd and 4th years. And then all of our PGY3s and all of our PGY4s also present at our grand rounds. This is outdated by 1 year. I need to update it for the most recent graduates, but this is sort of where our residents go after graduation. So as you can see, it's sort of split all over the place. Several go into fellowship, several go into private practice, several go into academics. We do value community service, and one of our biggest events during the year is our Spinal Cord Expo, which has been renamed the Ability Expo to incorporate all types of patients. But it's a really fun event. There are several vendors that come. We usually have a guest speaker. There's usually a wheelchair basketball game, and it's a lot of fun. The highlight of the year for sure. And then we also like to try and enjoy some free time. I love these pictures because the one on the top left is, 6 or 7 years ago, and then the bottom right is the same group of people with like more kids and older kids. And then I'm going to hand it off to Dr. Bolger.
Hi, everyone. Thanks, Holly. I was also thinking the exact same thing on that picture because I think Holly and I have added quite a few kids between the two of us to those 2 pictures. But so like she said, I am the program director for you'll hear it called the Triple Board Pediatric Rehab Program. You'll hear it called the Combined Program. They are one and the same. It is a fairly unique program in that there's only 3 of such programs in the country. And so it's a unique way that if you want to do pediatric rehab coming out of medical school, that you can get trained in pediatrics, physical medicine and rehab, and pediatric rehab medicine and be eligible to sit for all 3 boards at the completion of your residency training program. So what this looks like is it's a 5-year program. Your PGY 1 year is essentially identical to a pediatrics intern year that the pediatrics residents at Cincinnati Children's do, with a few minor changes, all of which promote rotations that as a pediatric physiatrist you would want to have experience with. And then as you progress through your 2nd to 5th year, basically every 4 to 5 blocks, you're going to flip between pediatrics-based rotations and then back to physical medicine and rehab rotations. And then throughout that 4-year time span, there will be pediatric rehab rotations intermixed. So what that means is that for your pediatrics time, you're going to spend time on hospital medicine services. You're going to spend time in the pediatric as well as the neonatal intensive care unit, lots and lots of different pediatric inpatient subspecialties, various pediatric electives like sports medicine, palliative care, rheumatology, neurology, really however you want to divide that, and whatever you're interested in. And then for PM&R rotations, it's going to be fairly similar to those that our adult PM&R counterparts are doing. A few differences in terms of number of rotations in general, because we have some slightly different requirements for the combined program, but still getting a good variety of inpatient adult rotations, musculoskeletal medicine, EMGs, prosthetics, neuro rehab consults, and then VA. And then across those two different divisions, so the pediatric and the PM&R rotations, you're also getting 12, and just like Holly, we went to a block system a year ago. So this is now 13 blocks of pediatric rehab rotations, totaling 12 months, combination of inpatient and outpatient months in peds rehab, and a really good variety of things, so we're probably one of, if not the largest pediatric rehab program in terms of faculty in the country. So we currently have 9 clinical faculty with 1 research faculty, and we are actively recruiting for an additional faculty. So we're a pretty large group with lots of varied interest. So really, getting you a really good, strong basic education, and, with the goal that if you want to practice pediatric rehab upon completion of residency, you can roll right into doing that and not need to complete any sort of pediatric rehab fellowship. So
it's 5 minutes. I think you're on mute, Dr. Perdue.
It's not a Zoom call if you don't try and talk on mute. I just said this is perfect timing because I think we are done. I'll just leave this slide up here. It's our website, our cincypmnrresidence.com, that has all the updates on the virtual recruitment season. And there's some meet and greet sessions, things like that. And then our emails are listed here too. Mary Duke is our program coordinator. So we will open it up to questions. Oh gosh, I just saw this question here in the chat about program changes that we've implemented because of resident feedback. I would say that this happens all the time. One of the things I can specifically think about is the change from, we used to have 3 different inpatient rehab rotations, 1 for spinal cord, 1 for brain injury, and 1 for stroke. And we'd have a resident on each of those. And now with resident feedback and their interest in having like sort of the senior junior role, we switched to just 1 giant inpatient rotation where we have a senior and 2 juniors. So that's just one example.
I think another one I can just kind of in general mention is the didactic schedule. So I am actually a graduate of the combined program here. And so I did residency a handful of years back. And when I was a resident, we had 2 kind of half days of resident didactics. So we would have, a couple hours on Thursday morning, a couple of hours on Friday morning. And the feedback we got from the residents a couple years back was that was really stressful because they felt like they were never fully protected. And so I think a big change was to go to that fully blocked, 4 to 5 hour Thursday morning time frame.
Welcome. And then there's a question about, have we accepted international medical graduates in the past? I actually don't know the answer to that. In the time that I've been here, I don't know if we've had any international medical graduates. I don't know, Dr. Bolger, if you know prior to me if there were any.
I don't specifically, but I think the way to look at this is that we do interview. I know that there's some specific visas that our institution cannot support, but for the most part, we would encourage all IMGs to apply. We would view those similarly. And then I would just throw out there that we have, in my time, ranked IMGs. We have not matched IMGs, I don't think. And so I would think of it as that, because we may have ranked, IMGs in our top 1 or 2 spots, and they just may have not chosen to come here. So I think, when you're looking at programs in general, ask people who they're ranking if they're able to tell you that, as opposed to who they're matching, because that may just not be the program's fault. That's a good question.
Yeah, so we look at all kinds of things actually, and this is a hot topic for us because we've both been researching this quite a bit on kind of what do we look at. So I think for me, honestly, I think students who are really interested in coming to our program, who genuinely show an interest and demonstrate that, and then also have some sort of longitudinal experience that sort of demonstrates their interest within PM&R. I think those are kind of big ticket items for me.
Yeah. And I would just add, eclectic interest, I guess, maybe, but like Dr. Pager said, more a dedication. I don't necessarily need to see that you did PM&R research, but I would love it if you picked something in your first year of medical school and did it throughout medical school, even if it had nothing to do with PM&R. I think that's really fascinating and just shows, your dedication to things. So,
yeah.
I will say from a combined peds rehab standpoint, because we are affiliated with a very highly ranked children's hospital, if there's anybody out there, I can certainly, feel free to email me if you have specific questions, but we do probably look at board scores just a smidge more than I would say maybe the adult program does, because we are, having to kind of go off of what they're recruiting for the pediatrics program, and that's a fairly competitive program. So it's a little bit different. It doesn't, the pass fail step one, I think is just going to make us look a little bit more at step two is my guess. But I think we're going to have a lot of learning in the next couple of years on how we're going to tease this all out. I don't think a lot of people across the country probably really exactly know how that's going to play into decisions.
Awesome. So if there aren't any other questions, if you guys, guess you guys have your emails up there already. If there aren't any other questions, I think we'll call it an evening. Thanks everyone for joining.